Years before her death, Teresa Margaret Mary Kelly is surrounded by loved ones, singing, laughing, and celebrating a choice she says more people should know they have.
I have stage 4 clear cell carcinoma, but prior to that, I was diagnosed with frontal temporal dementia.
Kelly is 69. She spent years searching for answers.
We were dragged to and from this hospital to that hospital.
But even in her last days, Kelly is in good spirits.
Hi, Dr. Moore.
She's funny, sharp, and quick to joke.
You missed the party. The drinks are all gone.
Parties wherever you are.
California is one of 13 states where a terminally ill patient with less than 6 months to live can request medication to end their life. It's called the End of Life Option Act, often referred to as medical aid in dying. California lawmakers made it permanent in October.
So from the time I had a diagnosis of frontal temporal dementia, I started thinking about aid in dying.
As her condition worsened, Kelly physically struggled at times to explain why she was ready.
So, well, for one thing, this is a big part of why I don't want to do this for 10, 11 years.
Years of tests left her exhausted and certain about what she didn't want.
So, it was a maybe with the FTD, but with the cancer, I'm done.
Kelly is one of a small but growing number of people choosing medical aid in dying in the state. In 2024, just over 1,000 people made the same decision she is. But that's still a tiny fraction of total deaths that year. Kelly worked with Dr. Douglas Moore to plan her end-of-life care.
The biggest accessibility issue is that people don't know that they have this option.
Without knowing their options, some patients spend their last months in pain, undergoing prolonged care, and racking up medical bills.
The biggest part of this is how much money it costs.
In the U.S., care in the final year of life averages $80,000. Patients are often responsible for thousands out of pocket. Medical aid in dying can be costly too, ranging from $3,000 to $5,000 between doctor visits and the medication, and it isn't covered by insurance. Moore says for many, the decision is about control.
They're really choosing it out of a sense of wanting agency over their life and wanting control and wanting to really choose how they exit this world.
He says a lack of awareness may be why most people who choose aid in dying are white. In 2024, only about 5 to 6% of patients were Asian or Hispanic.
I would love to see more marginalized communities, the awareness that this exists, and the profound sense of comfort that it can provide.
Now, a San Diego lawmaker introduced a new state bill that would strengthen how patients' end-of-life wishes are documented. It modernizes key forms like advance directives and do not resuscitate orders, so they're clear and recognized across health systems, in emergencies or across state lines. Kelly says she wants her story to help others understand their choices.
It doesn't have to be a terrifying, scary thing.
She chose to take her life on February 20th.
International Day of Social Justice. So I sort of want to give my heart to that as I leave the planet.
I'll be right behind you, honey. Did you call him honey?
She did. Yes, she did. Yes, she did.
Dr. Moore walks her to her bedroom, filled with flowers and flickering candles.
Yeah, Rhonda, Eileen, take it away, and Dr. Moore will hand you the drink.
Every long journey is made of small steps.
Friends share stories, hold her hand, and celebrate her life as she drifts off to sleep. Moore says Kelly's story shows what's possible when people know their rights and plan ahead. Heidi de Marco, KPBS News.